And I want us to focus briefly on the story on page 10 of the Daily Nation. Why counties are ailing despite 38 billion shilling medical equipment deal. We have had several complaints from the county governors and also from the senators. And I was speaking to the CEC for Health in Kajiado over the weekend on Saturday, and she was saying of how the equipment that was distributed to the counties, it was varied. Like different counties were receiving different equipment, not of the same value, but now they have to pay 200 million shillings every year for this program. And I'm just wondering, the plan was introduced. It was birthed in 2013, and the counties have been paying for this equipment over time, and now they feel that it is more than what is necessary. And I'm just wondering, this equipment that the national government brought in to assist the counties, and now the counties are complaining, do they have a way out, or are they bound by the signing that they made?
Sam, thank you for that question. I think it will depend on the manner of contractual agreement that they agreed into or engaged into. I think part of the challenge was the transitional arrangements that were set to help not only build the capacity sufficiently of the county governments, but also to help align it with the national government as was already in place, did not seem to have been done very well. And I recall that as we talk even of the context where in Kenya tenders and opportunities for tendering was continuing to go on, there were those who looked at the whole idea of equipment as one such avenue. So what would be useful at this stage is to ensure, as I had indicated earlier, in my view, it helps to get back to data, to get back to figures, to get back to specifics. If it is true that we had different qualities of equipment, can we indicate exactly what it is that was signed for or agreed for? Can we define what is in which county? Can we say what was then expected? And can we then get to a table? Because county government is a government. When you have a government-to-government conversation with the national governments to see how this is sorted out. Because I believe one of the issues also is that as we talked about responsibilities and defined who was supposed to be in charge of what, it is true that health was devolved, but there were quite lots of money that seem to have found themselves still here at Afia House. And the energy and issues around this is not as simple as we are seeing it here. I think part of what must be done is to encourage county governments, because they are a government, to not only look at the available regulations and legislation, but to also be those who can diplomatically sit with the national governments and find a way out, especially in the spirit of building bridges. We can build bridges between the national and the county governments as well.
And of course, of course, a case has been made for this equipment leasing system, because ideally it takes away the burden of technological obsolescence from the country. But also there are questions that have been asked, because for instance they are quoting Isiolo Governor Dr. Mohamed Kuti, who told the nation that he spent a considerable amount of money to get the dialysis equipment up and running. He apparently received dialysis equipment in his county, and this is the second governor, so the equipment landed in the previous term. In Turkana, a health executive, Jane Ajele, said the county needs 2 additional renal nurses, saying the 2 they have are inadequate. And now the health ministry has not responded to all these questions. Then someone says that Dr. Benjamin Sofa, an expert in health policy and systems at Kemri Wellcome Trust, said that a health investment that takes a huge chunk of taxpayers' money should involve some preliminary studies. But there is no evidence that that was done. And actually, Parliament was trying to look into this, but the health ministry refused to hand over the contracts that were signed for scrutiny. So you look at it, there's still a lot of information that is not known, because like the case of Kajiado, the CC Health, Esther Somoire, was saying that they came in for this second term in 2017. They found some equipment, or I believe it's a renal equipment. They are the ones who set it up and running. So again, a case of losing money. What do we do in such a situation where counties are still troubled with dealing with this equipment?
In my opinion, health is one of those functions that ought to have been dual management. The same thing we did with education. You say ECD, early childhood, is going to be done by the county, but from this level it shall be handled by the national government. That's what we should have done with health, because devolving all of it creates a conundrum, because you've got first inadequate resources within the county to sustain this equipment, but not just that, the thought process is not coherent. Let me explain what I mean. In other jurisdictions, you'll find a situation where you don't equip each and every hospital to do each and every process that is needed. So you'll find that there is enough facilities for basic health care, but then you'll have a big children's hospital in Nairobi, a major heart hospital in Mombasa, a major renal hospital in Kajiado, such that now where you have those referral centers, you concentrate the equipment, the facilities, the professionals, everybody in that place. What we have now is a case of 47 little governments that each want to have a shining star of a hospital that has everything available to people where they are.
Right.
That's not how it works, because what you have is a situation that we have now where you've overstretched the professionals to a level where they're no longer effective. You have overstretched the resources, and the equipment, like some of that equipment we're being told was actually not being utilized simply because there's not a reliable supply of electricity, or there's not a constant supply of equipment or what you need for the equipment, for example. Some of the equipment is also becoming obsolete, so that you're not even able to get the servicing or the parts that you need to keep it in proper working order. So in my opinion, health has to be renegotiated, not for the sake of which county wanting to look like they can shine or which one they'll not. No, because it's too big a thing. In this nation, if your people are not healthy, they cannot work. If they cannot work, they cannot bring money into the economy. They can't bring money in the economy, there's no money for government. It's a vicious cycle. It is in government's interests to make sure that health works. But over and above that, I also wish our governors will get to a place where they sort of leave their wanting to shine. Build the hospitals in your county, yes, but some of these things, let's negotiate on a more even keel and say, look, I can't handle this. Don't give me this equipment. Me, I'm happy to provide enough ambulances to take my people to the neighboring county. Let's concentrate on this one. It looks better equipped, and let my people get excellent service there than pretend to do service here that's not quite up to speed.
You know what, the one thing in health, and I know when we were in Senate, all these questions we asked. And I remember we had a lot of conflict, because you'd ask, fine, you're bringing to 47 counties dialysis machines. Do we have qualified staff to deal with it?
Did you get the answers?
There were no answers, but they pushed it. As it's being told here, indeed they pushed. Then you tell them, look, you'll have machines in some of these counties, because why we had functions and devolved functions, and why every county was unique. It's because each county has its own strength. So we have a county where you already have a referral office, hospital. You needed the equipment because you have a referral hospital where to put. But you have a county, you're starting from zero. Do you really need the equipment? No. You need first to come up with a facility where now you bring in the equipment, meaning in 5 years, you would have just done a negotiation with your counterpart or your neighboring county and say, look, I am good in this, but all my patients, we will get ambulances, as Joy says, and we'll ensure our patients are able to come for treatment here. And then you sit down with Treasury and relook and have an agreement, a contract, that money spent on this side is this amount. Because we have some hospitals which are referrals, you find all counties are going there. So who pays them? Because the problem has been the payments and all that. But at the same time, when I look at this program, it's very sad. It's a program where you feel disappointed because you have machines but are just lying there. And yet people are still going to India. Why were we bringing machines? To reduce people going for tourism, and health tourism in other countries. That is why we were trying to invest in this. But if we are still going, a high number is still going, then it means we have to again invest in our human resource. for us now to get qualified people. These are new technology. First of all, the machines are new with new technology. Therefore, those who trained in imaging those days, you know, you have to retrain them again to understand this new technology. Because the machines they were used to are very different.
Right.
The monitors that you go today in hospital, the CT scans that we have are so different in what they were using those days. So you find it is a program that was very good, but well thought through? No. Wastage of money? Yes, because you can't now just come now and tell a county you have to be paying 200 million a month. Now, a county like Lamu, 200 million per month, vis-a-vis what the equipment is, I mean, when you look at the surplus that you're paying for this, but it is underutilized completely. Nobody's using the equipment, so why are you paying? I would rather even they say, those who are not using these equipments, can you bring them to Kenyatta? Take them to the Kenyatta, Moi referral, take these equipments
where
there.
they can be used.
So that we don't just have taxpayers' money seated somewhere for nothing.
All right, and I think I want to leave that debate on that point, and I hope that a solution can be found so that we do not have to discuss issues of equipment and what have you, because at the end of the day, it is the Kenyan who needs that service, and their health complications will not wait for that resolution. Now, I want just to sample some of your feedback, but before I do that, on page 2 of the Standard, you'll see a very disturbing photo or a series of pictures, page 2 of the Standard, in search of a better future. If you can have that image on page 2 of the Standard. This is some pupils at Jehovah Jireh Primary School in Nairobi's Kasarani. You can imagine Nairobi. The kids are having to sit on desks made of just 2 stones, then
A plank.
a plywood or a piece of wood. They sit on that. Others are having to lie on the floor to read their books and to write. Then when the class is on the last photo, you'll see them sitting on their legs to study. This is the city of Nairobi.
Is it a public school?
Jehovah Jireh Primary School.
I'm not too sure, but this is a tragedy. But do you know something? I realized in our slum areas and informal settlements, because there is no plan for people to live there, then there's no schools for the children to attend. When there's no schools for the children to attend, or they cannot afford to pay the little bit, or they cannot travel out, then such schools spring up, these informal schools spring up. The problem with the informal schools is now something like this. There's not adequate facilities to aid the learners, but yet the children in the slums need to learn. They need to have something. You know, I realized, for example, let me go back to my roots, Embakasi. You have the Soweto slums. These people, because it's an informal settlement, they don't even have primary schools to go and vote. So they go to the neighboring counties to vote. When it comes to development, the MPs are saying, you know, you guys voted in that other side, you guys voted in that other side. So you've been disenfranchised because you've come up in informal settlements. Government ought to have a look at this and have a policy where, for example, education is based on population. If you have X number of people living in a certain area, the government must put up a public school for children. It must become policy.
All right, and finally, to look at the feedback, the national government, this is Kiprono Abraham, says that the national government should hire equipment using the 85% it retained and distribute them to counties. This spending from the sources is actually robbery without violence by anti-devolution people. I believe he's quoting 85% because the law requires that a minimum of 15% be sent to the counties, but through the years it has been slightly above that. Someone else says that, this is Dan Alila, he says that President's visit to Kisumu is a sign of humanity and empathy. We are ready to give him an overwhelming welcome. We are always kind and generous to visitors. Rais, karibu Kisumu. Dan Alila, thank you for watching Citizen TV. Well, and finally, ladies and gentlemen, as the executive and legislative arm to come up with amendments to both the Constitution and the law to make all economic crimes unbailable. That way, Kenyans will breathe a sigh of relief from these rounds of remands and then bail, and finally the release of culprits. This is Stephen Tuke from Matunda. Matunda is in Kakamega, Elijah?
Matunda is in Trans Nzoia.
Oh, okay. I was trying to...
It's near there.
But
don't
it's
worry.
on the border. It used to be in Kakamega, so it's
Ah,
on the
okay.
road.
Then I'm close. I think I went there when it was still on the other side.
Yes, yes.
Anyway, so
Yeah,
thank you so
sorry,
much
yeah.
for watching. You can see the frustration that Kenyans are having now, even recommending that we review the law so that people are not bailed out of crimes. Professor Jacqueline Oduol, Beatrice Elachi, Honorable, and Joy Mdivo, thank you so much for coming to Daybreak on Citizen TV, and thank you so much for being loyal to the show. If we do not see you again, Merry Christmas and a Happy New Year.
Oh yeah, Merry Christmas. And I want to thank my spiritual mother, Mama Charisia. She ushered us into the Christmas season. And Kenyans should call it Christmas. Don't start telling us some happy holidays and it is Christmas, the birth of Jesus Christ.
Okay.
That's what children used to celebrate those days in the rural, yeah?
And then they grew up.
When we were
decided
growing up,
be
it was
happy
better
holidays.
Christmas. But nowadays, that's happy. There's nothing like happy holidays. It's Christmas, so that kids will understand why do we celebrate Christmas.
Right.
It's
The reason for
because
the season.
we are enjoy to bring in the happy birthday of Jesus Christ, and they need to understand that.
Okay. All right. Asanteni sana.